going to talk through traction of the cervical spine for hypomobility of the C6-7 joint. The goal of this treatment is to elongate the soft tissue of the spinal joints by distracting the facet joints and allowing for greater motion. This modality is indicated, but it's typically best for a whole spinal segment because it's difficult to isolate just one segment. However, you're able to adjust the angle of pull to try and focus the traction forces on that one segment. Some contraindications to be aware of prior to treatment would be primarily patients with hypermobility in other joints that could cause more harm than good with traction. So it's good to clear out those reports in the physician report. Other things to be aware of would be if the patient has dentures or TMJ dysfunction specifically for cervical traction, that would be a contraindication. Also, if the patient has had an acute injury to the area within 72 hours, or if they have uncontrolled hypertension. Some things that we need to assess prior to traction treatment is going to be the patient's mentation. So the patient needs to be cognitively aware to tell you if the symptoms peripheralize or move distally, because this is also a contraindication to traction. For the parameters for cervical traction, I will have the patient lie in supine, and to target the lower cervical vertebrae, I would have the patient have slight cervical flexion. Next, we need to choose the amount of traction. So for cervical vertebrae, you want to choose no more than 7% body weight. So if your patient's 100 pounds, you would want to apply 7 pounds of traction. Finally, I would use intermittent traction on this patient with a 1-to-1 ratio of maximum to minimum traction. I would have a 15-second on and a 15-second off time. For patient positioning, I need to make sure that the patient is comfortable lying supine with the neck in flexion for 5 minutes. The first treatment will last no longer than 5 minutes, just to ensure that the patient can tolerate the treatment. Follow-up that is needed is at the end of the treatment, the patient needs to be instructed to move slowly and cautiously. Have the patient lie supine for 2 minutes, and then side lie for 2 minutes, seated at the edge of the bed for 2 minutes, and then standing for 2 minutes. After the patient is standing, you need to instruct them to move cautiously without rapid rotations because this could cause more damage to the joints. Finally, other interventions that could be used for this treatment would be manual traction by the physical therapist, but this is usually not recommended because the physical therapist could fatigue, or the patient can use self-traction themselves at home, but they need to be educated on the proper use of self-traction, especially since it's a cervical spine.